Hi, I'm Dr. Vijay Sohanlal, Senior Orthopaedic Consultant at MGM and Mahi Clinic. Today I'm going to talk on arthritis. Arthritis is nothing but an inflammation of a joint, any joint for that matter, knee, hip, small joints of finger and toes. This arthritis can cause pain, swelling, difficulty in walking, and decreased range of movement. So, if you have been diagnosed with arthritis, what you should be doing it? At the early stage, there are enough measures are available. Probably anti-inflammatory and physiotherapy can help. Moderate stage of arthritis, where painkillers and physiotherapy will not be a much help. We can think of injecting hyaluronic acid and platelet-rich plasma. Both these are safe. In my clinic, I do use hyaluronic acid and platelet-rich plasma depending upon the condition of the knee pain. I don't use steroids because steroid itself causes a lot of damage to the knee joint. Initially, when we give steroid, patients really feel good, but long-term effect of steroid is not that great. And what to do when there's a severe osteoarthritis of a knee joint, where the painkillers, physiotherapy, injections within the joint do not work, and patients still continue to have pain in spite of trying all these measures. All these things are difficult. Let's say sitting cross-legged is difficult, walking and climbing stairs up and down is difficult, doing their day-to-day activities like going to the toilet, coming back from the toilet, and visiting to the temple. If all these things are difficult, then ideal would be to go ahead with the total knee replacement. That's the best option in this given scenario when all other measures fail.